The views and opinions expressed in The Fact Is with Hollis Grant are those of Hollis Grant and do not necessarily reflect the official policy or position of Droids Canada Network. Droids Canada Network does not take responsibility for any content or position produced by Hollis Grant and his show. Listener discretion is advised.
Good morning, good afternoon, and good evening. Thank you for tuning in to another edition of The Fact Is. I'm your host, Hollis Grant. And if you're listening to this episode, it is week 46 of 2022. We've covered on the past episodes. You can go back and take a look on Droids Canada, which happens to be the award-winning Droids Canada network. Has been recognized as the best radio station in the town of Welland, Ontario. So here we are broadcasting on the Droids Canada network, which outdid all the local radio stations. But as you can tell, I'm sick. Week 46, it's unavoidable. Kids get sick this time of year. We've covered the statistics going back all the way prior to 2015, again on past episodes. And we know that this is the time of the flu, the time of the seasonal cold. So when COVID happened, we knew it was a seasonal cold, a very bad seasonal cold. However, a cold nonetheless. But how's the rest of the world handling this? In Ontario, Ontario's top doctor, Dr. Kieran Moore, has come out and started talking about mask mandates. Now, here's an article from CBC News, which happened to be dated from November 15th, 2022. Ontario's government is, quote, strongly recommending masks indoors. Why stop short of a mandate? Laura McQuallen from CBC News doesn't want you to stop short of a mandate. She just wants you to have a mandate and listen to government. Listen to the officials. Again, CBC, the Communist Broadcasting Corporation of Canada, which is run by the unions. Multi-billion-dollar scheme. The pediatric hospital is overwhelmed by patients ill with a trifecta of respiratory viruses. That's pediatric hospitals. Despite increasingly urgent calls from doctors for a renewed mask mandate in Ontario, the province has issued a strong recommendation leaving masking up to individuals at a time when experts say governments are wary of the political consequences of forcing health restrictions onto the public. Medical professionals have urged new masking requirements in indoor spaces, including schools, and as hospitals across Ontario feel an earlier than usual strain from patients ill with respiratory virus and influenza, as well as COVID-19. Now, it is worth noting that as the population of Ontario grows at a rapid pace, the existing infrastructure has not increased over the years. Hospitals such as in the city of Brampton have been overwhelmed even prior to COVID because the amount of new people moving into the city has bogged down healthcare. All across the GTA, hospitals are ill-equipped for the population that they have already. So, yes, the healthcare system is overrun. Is it overrun by COVID? No, it's overrun because the lack of beds available in any given day. Waiting lists continue to grow and the hospitals are continuing to be underfunded. In Ontario, some children's hospitals are scaling back procedures and sending some other patients to adult hospitals as their intensive care units are overflowing with cases of respiratory illness in kids. Pediatric hospitals in Quebec also report their emergency rooms are operating beyond capacity due to the 3 viruses. On Monday, Ontario's Chief Medical Officer of Health, Dr. Kieran Moore, recommended wearing masks indoors, including at social events where young children were present, as kids aged 4 and under were highly susceptible to the RSV and influenza. Moore was still discussing and reviewing whether masks should be mandatory in schools, he said. The Ontario Medical Association welcomed the province's recommendations, but individual doctors are continuing to push for more measures in schools to help reduce the pressures hospitals will face in the weeks ahead. Considering how full our hospitals are, more needs to go further than this. There literally is no capacity at our pediatric hospitals, Toronto Emergency Room physician Dr. Kazif Perzada told CBC Network. Now, have you noticed the word literally has become ever so popular in the last 2, perhaps 3, pushing 4 years? Everyone uses the term literally. It is literally the most overused word today in the English language. Literally is used so much on Twitter and is used so often by people that closely align themselves with liberal views and democratic views. Literally. But you notice those key buzzwords will make their rounds, and you'll see new buzzwords coming in. And as people use literally when there's no reason to use it, you'll see it phased out in the next year or so. Moore could have addressed the core of the problem by asking school boards to bring in some measures to protect kids and slow down spread amongst kids. Political and health experts say they believe the government is concerned about the potential for a public backlash with protests and other pandemic-related restrictions, including vaccine mandates, still fresh in its memory. I think part of what's going on here, both at the level of the medical officials and of the Premier, is an assessment of the political risk of requiring something that may be very unpopular and not followed that closely by a fair number of Ontarians, said Peter Graff, an associate professor of political science at McMaster University in Hamilton. Essentially, he's hinting at the quote-unquote evil truckers, that were so evil that the government of Canada had the Emergency Orders Act, which is really to be used in times of war, most extreme cases. The committee is still out on that issue, whether or not the federal government went too far. But to label these people that don't agree, you want to label, again, going back to our first episodes, and labeling and demonizing your opponent in every situation that you can. Because what you want to do is you want to call, in this case, people that don't agree with you, call them the trucker convoy people or anti-maskers or anti-science deniers. But when we look at the reality is that even with masks, COVID still spread. Even with the vaccine, it still spread. So is there a point to wearing a mask? If you're sick, throw one on. If you don't want to sneeze on people, and I'm one for not sneezing. In fact, when I'm ill, even before COVID, I just wouldn't go out because I really don't want to be out in public coughing and sneezing on people. Last thing I want to do is go to a store and sneeze on a bunch of product, cough on a bunch of product. Nobody wants that. I don't want to buy a product that has someone's snot on it, and I'm sure you don't either. So common sense is if you're sick, just stay home. A mandate could be interpreted as a signal that it's no longer safe to dine out, shop, or visit other businesses, many of which have already struggled through multiple prolonged lockdowns, Brock said. Once you make it mandatory, it's more serious, and people are going to pull back again. That's going to hurt the economy, and we can't afford that right now. So this, to me, shows the government who's grappling with some very tough questions. Dr. Thomas Pigott, the CEO of Peterborough Public Health, said he has no doubt that compulsory masking would help alleviate the scary situation his region's hospitals are dealing with. But ultimately, I think that's a political decision at this point. Masking is an intervention that comes with absolutely no known evidence of harms. And That's the reality. Unfortunately, though, the past couple of years, there's been politicization of masking. So instead of health prevention, it's seen as a symbol, he told CBC Radio's The Current. Medical professionals say Ontario's government has a lot of work to do to change those perceptions and encourage more masking, including sharing information and evidence at a community level about the effectiveness, including against influenza and other viruses. One thing we've learned very clearly during this pandemic is that masking reduces the transmission of influenza. Not quite as clear for other respiratory viruses, said Dr. Alison McGreer, an infectious disease physician and senior clinical scientist at Sinai Health Systems in Toronto. We're in this really difficult time where, yes, we want to leave the pandemic behind, but A, it's not left us, and B, we've learned some things that can help us save lives without doing a lot of work. Some doctors have also suggested providing free masks at the entrances to schools, malls, and recreation facilities as another way to encourage people to wear them indoors. And of course, who's going to pay for that? The taxpayer. More taxes to be collected, more funding to go in to these different regional uh, health departments. And then after this is all done, they can continue to ask for more and more money on their budget rather than reducing the cost of their administration. Keep on increasing that. More than anything, the public really needs decision-making tools about when and where to mask, what kinds of masks to wear, she said. We don't need to mandate things to send a clear message on why this is important. And the good thing that we are going to happen if we do it, if we all pull together now, one thing we could look forward to is a healthy holiday season. Who doesn't want that? Now, that kind of reminds me of the old 2 weeks to crush the curve. All we need is to end this virus is to get a vaccine that works. And that lasted for 2 years. And in fact, America is still not even opened its borders to non-vaccinated people. One of the last countries in the world to not allow people that aren't vaccinated into their own country. So what does Ontario's top doctor have to say? And here's taken from a news conference. It's a 2-minute clip, but listen to what he has to say.
Responsibility as the Chief Medical Officer of Health is to inform Ontarians. And I think the first step is educating. It's not just COVID-19 anymore. We are dealing with the complexity of COVID-19, influenza, and RSV. And I'm very concerned that children are being admitted to our hospitals and are in our intensive care units, principally 4 and under, that cannot mask. So everyone around them, the parent, the sibling, the grandparent, I'm urging them to protect the most vulnerable of us, our children, by adhering to all the layers of protection. What might be a cold to you can lead to a severe respiratory infection in a child 4 and under. So there is a complexity now that it's important that all Ontarians understand, and we have to get back to the basics. If you have children and you yourself has a cold, that can be a serious and significant respiratory illness in a 2-year-old or 3-year-old. So as we go indoors, my principal message today is to protect our children, follow all the layers of protection. Our hospital system needs us to protect our children more and more. And it's not just masking, it's the layers of protection. If you have any symptoms of infection, you should mask around those that are most vulnerable to our individuals. You should be screening on a daily basis. Good hand hygiene is going to be exceptionally important with RSV and influenza. It's a call to vaccinate against influenza and COVID, as there's no vaccine against RSV. We need to protect our health system. We need to protect each other. And it's really getting back to all of those basics. We need a reboot, a reminder of what will keep us safe for the rest of the winter season. And today's the key message of getting back to the basics of protecting our most vulnerable. This is different than COVID. This is protecting our children and those that are the youngest above us. Please, parents, grandparents, siblings, if you have any respiratory symptoms, you must mask around those that are vulnerable. Masking mandatory masking in a certain venue may help decrease the risk at a community level, but I'm very concerned about our children and protecting our children right now, and it's best that we protect them through masking in the home environment and in any social situation as we go into what will be a very social environment in winter.
So there you have it. If you have children and you're sick, Ontario's top doctor wants you to wear a mask in your own home. Wear a mask wherever you can to protect the children that are 4 and under, but yet are recommended to wear masks if they're over the age of 2, because we've seen countless videos of poor kids being subjected to wearing masks all through the lockdowns, all through the last 2 years. And to protect against this deadly virus that doesn't have a vaccine, because RSV does not have a vaccine. Now, where have we heard this one play out before? Where have we heard we have to get a vaccine because the vaccine will protect us and protect all those vulnerable? And as mentioned, this is different than COVID. If it's different than COVID, this is the new COVID, the children's COVID, COVID-23, RSV, children's COVID-23. Kind of has a nice little ring to it. But don't worry, our elitists are there to keep us safe, keep us indoors, while the policymakers jet off all around and all across the world, as Justin Trudeau has, and when he was not even in the country for Remembrance Day. And Remembrance Day in Canada is it's like a Memorial Day for all fallen soldiers, all soldiers living and deceased that have gave their lives for the greatest sacrifice for their own country. And as community leaders and all in the community gather around the local cenotaph at 11 o'clock, and at 11:11, there's a moment of silence. Every politician goes to these events because they know the older people go out and vote, veterans go and vote. But yet, Prime Minister Justin Trudeau decided that he would not take part in these festivities and decided that he would be out of the country, and currently still out of the country. But as this new disease is ravaging children 4 and under and putting them all in hospitals, and our hospitals are strained, yet no new hospitals have been built, and the population keeps growing. We have to keep the children safe. We have to mask up, to stay inside. We have to wait for a vaccine. Sound familiar? I'd like to thank you for tuning in this week to The Fact Is. I'm your host, Hollis Grant, and I hope you have yourself a great week.
Dun, 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 dun. Salsa shark! We're gonna need a bigger boat!
Throughout history, they have been a part of our Canadian life. Men and women who have made their mission to entertain their fellow man. They've worked hard enough. Isn't it time they had their own podcast?
Droids Canada. This podcast would be great if it wasn't for the internet trolls.
I don't bother them and they don't bother me.
I could do without the bad reviews in the iTunes store.
You have that podcast with that guy who was at that Comic-Con in the last year.
You should hear the barrage of the stupid questions I get on our SoundCloud account.
What do you mean it was coughing? How am I going to hear a podcast with coughing?
You feel a lot better if you just rip into the occasional guest.
You're a host who doesn't get paid. You can't just do anything you want while you're recording.
What kind of podcast are you running here anyways?
Droids Canada Podcast present.
You think anyone can see us down here?
Why, you think you want to have sex or something?
Can we?
Droids Canada Podcast. The only show to rip off a Clerks trailer.
You hate people!
But I love Comic-Cons. Isn't it ironic?